Hello and welcome to the weekly health webinar brought to you by JKYog and Radhakrishna Temple of Dallas. Did you know that 50% of women in the US age 50 or older will break a bone due to osteoporosis? But most people don't realize they have osteoporosis until a fracture happens, as there are usually no signs or symptoms. That is why osteoporosis is often called the silent disease. But the good news is, in some cases, osteoporosis can be preventable. The sooner you start keeping your bones healthy, the better off you will be in your 50s and beyond. To tell us more about the causes, treatment, and prevention of osteoporosis, we have with us today endocrinologist Dr. Sumana Gangi. Dr. Gangi graduated medical school from India. She did her residency at Monmouth Medical Center, Long Branch, New Jersey, where she was awarded Best Outgoing Residence for excellence in research and academic affairs. Dr. Gangi has completed her fellowship in endocrinology from the University of Buffalo in New York. She is board certified in endocrinology, diabetes, and metabolism and internal medicine. She is a member of the American Medical Association, American College of Physicians, American College of Clinical Endocrinologists, Endo Society, and American Diabetic Association. Her clinical interests include diabetes, obesity, thyroid, and adrenal disorders. A quick reminder, we will have a brief Q&A session after the presentation. So if you have any questions relating to today's topic, do submit your questions in the chat window. With that, I am delighted to welcome Dr. Gangi. Dr. Gangi, thank you for joining us. Over to you.
Hi, good evening, everyone. Thank you for the kind introduction, Ragini. Today, we will be talking about osteoporosis. So it's generally called the silent disease unless you break a bone because it doesn't give you pain. Most of the times people misinterpret arthritis as osteoporosis. Like, as we get older with the wear and tear, we get joint pains and people think that there is a relationship between arthritis and osteoporosis. So when we talk to people who had osteoporosis, they tend to deny, saying that they don't have any issues because it doesn't give them the pain. So osteo means bone, poros means pores in the bone. So that means the bones are becoming porous, means they are becoming weaker. So who is at risk and what do we need to do to prevent? We will discuss in a bit. So as I said just now, that it's a metabolic bone disease. It's characterized by loss of bone density, where that architecture of the bone becomes more frail and makes the people susceptible to fracture. So when we do look for osteoporosis, when we do the imaging, we look at the bones of the spine, that's called vertebrae, and hips and the wrist. So generally, the bones that are thinner bones tend to express the loss of bone early on. That's why we look at the spine, because the spine, the vertebrae are one of the smaller bones. And a second most common area to fracture are the hips. And hip fractures increases the mortality. So that is the reason why we also look at the hip bones when we look for osteoporosis. And another thing with the hip bones is you have a long bone called femur and horizontal bone, which is like the sacrum, but the tiny bone connects the long bone to the horizontal bone. It's called the neck of the femur. That is where most people tend to fracture the bone. So when we look for osteoporosis, we are looking at those bones that are susceptible to losing bone density as well as more prone for fractures. So this is the texture of the bone. This is what, as you can see, the top one, this is the femoral neck. This is one of the most common areas of the fracture. And this is a normal bone. As you can see, it is much thicker and dense. And onto your right side is the osteoporotic bone, where the bone is thinner and more holes appear as the bone loses the density. Okay. So when we were born, like, our bones are tiny, they are frail, they are soft, and as we hit puberty, that's when bone starts fusing, and they also get stronger. So the peak bone density happens when we are in our late 20s to mid 30s. So in women, once they hit menopause, it's generally anywhere from 48 to 52. In US, it's between 48 to 52, but it changes depending on your family history, genetics, and other factors. And once you hit menopause, and prior to hitting menopause, it's called perimenopause, where your estrogen levels are dropping. That's when you start losing the bone. And most people get diagnosed with osteoporosis in their mid 60s. So even though it is considered as a woman disease, men are not immune. So that there is another myth that, when we talk about osteoporosis, it happens only in women, but it's not true. It's more common in women, almost 3 times more common in women than men, but men can develop osteoporosis too. And we will discuss that in a bit. And advanced age, as we get older, like anything else, the bones start losing density. One of the most common reasons is the hormonal changes. And also, if you are not taking enough calcium and vitamin D. Family history is very important. Some people, they are born with the brittle bones. And also, if your mother had osteoporosis or fractured bones, you are at a little bit higher risk compared to general population. And a sedentary lifestyle, like not doing any exercise, also helps you, also makes you lose bone density. Any kind of strength training will really help to improve the bone density. And smoking is one of the most common reasons for osteoporosis, and also excessive alcohol consumption. And also people who take certain medications like steroids, like prednisone, or like seizure medications like dilantin. Those seizure medicines prevent the absorption of vitamin D and make you prone for osteoporosis. And if somebody is very skinny, or if they had a drastic weight loss in a short time, those people also lose their bone density. And Caucasian women, that means white people, and Asians, they are more prone for osteoporosis because their build is much smaller compared to African Americans. So in men, if they have prostate cancer and if they are taking certain medications for prostate cancer, those patients develop osteoporosis like women. And also if they are on medications like steroids, like prednisone, for long term, for whatever reason, for respiratory reasons like asthma or COPD, long-term use of steroids can make you prone for developing osteoporosis. And the other causes, most common reason for osteoporosis is advanced age. And the second is the postmenopausal woman. And the other thing is young people getting osteoporosis. Certain medications make you as if you are in menopause. Some people, they use progesterone as a birth control, and the progesterone stops your periods, and it looks like as if you are in menopause, and that can cause bone loss. Certain psychiatric medications like risperidone, they are antipsychotic medications. They increase your milk hormone level called prolactin, which stops the menstrual cycles. And people who are on those medicines for long term, they are also at a higher risk for osteoporosis. So depending on your risk factors, we start screening for osteoporosis. So the most common age when we start screening for osteoporosis is right after menopause in women, or after 60 years of age. But if you have risk factors like, smoking, or if you fractured your bone with a minimal injury, or if you've been on corticosteroids or steroids, or if you are on any antipsychotic medications for long term, then your risk for osteoporosis goes up. Then we start screening at a much younger age. And for women, generally the way we do it is like 2 years after your menopause, we do the first bone density scan. And if it is normal, we repeat it every 2 years. And if there is an abnormality, or if you already have osteopenia, which means beginning of osteoporosis, then we may repeat it in a year to see how fast you are losing the bone. So other reasons for osteoporosis, secondary to the other conditions that patients have, is again we discussed the calcium and vitamin D deficiency, malnutrition, and if people have celiac disease means they are sensitive to gluten and they don't absorb a lot of vitamins. Those people are also at a high risk for osteoporosis. And if you have a thyroid condition called hyperthyroidism, where your thyroid is overactive, that can also cause osteoporosis, because excessive thyroid hormone can pull the calcium from the bones into the blood and make your bones brittle. And also if you have a low thyroid and taking a medication, and some people tend to over medicate it thinking that it might help them with other things, that can also cause osteoporosis. And if some people have kidney problems, kidney disease can change the metabolism and balance between your calcium, magnesium and phosphorus. Those are the minerals that help the bone. So people can have a dynamic bone disease if they have kidney problems. And anytime people have GI issues or liver issues, they are also prone for osteoporosis. And if somebody has like bone marrow diseases like leukemia, that can also cause osteoporosis. And certain medications, I think I already mentioned multiple times already, like, the steroids, thyroid hormone in excess, or any anti-seizure medications, they increase the risk for osteoporosis because they prevent the absorption of vitamin D, and steroids also alters the bone matrix. And lifestyle, it's very important. Sedentary lifestyle, taking excessive caffeine. If you are drinking more than 2 cups of coffee, you can assume that you are at a higher risk for osteoporosis. And smoking and excessive alcohol intake, because alcohol also prevent the absorption of vitamin D. So, and it also works against the conversion of one form of vitamin D to the other. So that can also affect the bone density. And if somebody has rheumatoid arthritis or osteoarthritis, and if they are taking certain medications for those arthritis, those medicines also can make you at high risk for developing osteoporosis. And as I said, it is called silent disease because we don't lose the bone overnight. We lose the bone mass very slowly over a period of many, many years. And it doesn't give you any warning signs or symptoms. So suddenly some people come in and say, I used to be 5'7", now I am only 5'5". We know they had osteoporosis and they fractured their vertebrae and the vertebrae are collapsed. They may not have any pain, but they lost their height. So and sometimes people may come in with a nagging low back pain or like mid back pain. Then when we do the x-rays, we can see the vertebral bones compressed and they had collapsed. And this vertebral collapse is what called the hump that we seen in older people where they have like, hunchback. Okay. So this is like, normal bone at age 55. As you can see, the spine is pretty much straight. It has the native, like, arch. And then as we get older, the arch gets deepened. And then already from 55 to 65, they lost a lot of bone and their height had gone down. And this is called the hunching at age 75. And this is because the vertebra fractures and the collapses and the gap between vertebra is not seen, so it looks like a hunchback. Okay. How do we diagnose osteoporosis? We don't want to wait until we lose the height or like we develop that hump, right? So the most common test to do for osteoporosis is the bone density. It's called dual energy X-ray absorptiometry. And we generally start screening at age 60 or above. Or if somebody is in menopause, we start the bone density 2 years after the menopause to look at the bone mass. And then we evaluate based on the bone density. It's every 2 years, or if they have a severe bone loss, we may repeat it in a year. And some people, they check the x-rays, like somebody, if they complain of back pain, and we may get an x-ray and for some other reasons, and the x-ray says there is a bone loss, then we follow up that with the bone density test. And then sometimes people do ultrasounds. That is not very common in United States. So for diagnosing osteoporosis, the standard of test is the bone density test, or it's called a DEXA scan, which means dual energy X-ray absorptiometry. So the treatment for osteoporosis, the goal of the treatment is to prevent it. So if we lead a healthy lifestyle, take enough calcium and vitamin D, and exercise on a regular basis with a little bit of strength training, you can prevent osteoporosis. And then once you develop osteoporosis, the goal of the treatment is to minimize the bone loss and to prevent the fractures. So generally, the taking at least 1200 milligrams of calcium and at least 1000 units of vitamin D. If you are in menopause, then you need at least 1500 milligrams of calcium every day. But if you have any other conditions like, lactose intolerant, which is very common in Asian population, that means you are not absorbing, you are intolerant to dairy products, then you should be taking calcium and vitamin D supplements much earlier on. If you are on medications like Caesar medications, you should be taking the calcium with vitamin D when you start your Caesar medications. The same thing with the corticosteroids. Also, if you have any problem with absorbing the food for whatever reason, like if you have acid reflux, and if you take those medications to help you with acid reflux, like those omeprazole, Nexium, those kind of drugs, then you should be taking calcium with vitamin D when you are on those medications, because they also prevent the absorption of calcium. And there is a myth that milk and cheese and yogurt are very good, high in calcium. Yes, they are high in calcium, but they don't give you enough of the daily requirements of calcium. Especially with the different diets that are popular at different times of the year. You have to look at your daily, food intake and need to assess. For someone to get enough calcium from milk, they need to drink at least half a gallon of milk. So that is not really healthy. So it's good to have 1 or 2 cups of milk, and look at your other dairy intake and getting exposure to sun, where we synthesize vitamin D, and also from other food we get calcium. But if you are taking, as I mentioned, any of the medications, including acid reflux medicines, it is better to take a supplement of calcium and vitamin D. Again, the required calcium is 1200 milligrams of calcium and 1000 units of vitamin D for most people. But if you are a woman and in menopause, we recommend the 1500 milligrams of calcium and at least, again, 1000 units of vitamin D every day. And quitting smoking. If you are a smoker, stop smoking will actually help the bone density. Okay. And exercising regularly since childhood, if you have children and if you have a family history of osteoporosis, it's a good habit to encourage your children to do regular physical activity, because it really helps their bones. And especially in teenagers, when they are in adolescence, when they exercise during adolescence, it helps them to reach their peak bone density. And minimizing the alcohol and caffeine intake will also help to preserve the bones. And people with low body weight. Like some people genetically are very thin, or some may have lost a lot of weight for whatever reason. It could be from health conditions, or because of eating issues, or like malnutrition. Those women also need to be extra cautious when it comes to their bone density, because if you lose weight very quickly and drastically, besides losing weight, you also lose the bone density. That's why people, when they have bariatric surgery and lose a lot of weight, they are very high risk or prone for fractures. So now we talked about what is osteoporosis, who are at high risk, and what we need to prevent. And now let's discuss what we need to do if you are diagnosed with osteoporosis, right? There are different drugs. Depending on the risk factors and ability to tolerate the medications, we choose a different class of drugs. The most common drugs that are out there are most commonly prescribed are called bisphosphonates. They help to minimize the bone loss and helps the osteoclastic activity. That means it's like a cement that builds the bone. They come in pill form as well as the injectable form. The pill form is like once a week or once a month, and there is one pill that is available as once in 3 months. And there is once an yearly infusion of the bisphosphonate. What are the side effects of the bisphosphonates? If you are taking a pill, you have to take it on an empty stomach and wait for at least 45 minutes, and you can't lie down flat because it upsets the stomach. People who have acid reflux disease or who have ulcers in their stomach, they may not be able to tolerate these drugs because they may worsen the reflux disease or may develop ulcers. That's the main thing. And also it can lower the calcium in somebody who already has a borderline calcium. I think those are the main side effects. And the second class of drug are called RANKL inhibitors. We have 2 drugs in that class. One is called Prolia, which is every 6 months intramuscular injection, and the other one is called Evenity. And they also prevent the bone loss and helps to rebuild the bone. Third class of drugs are called synthetic human parathyroid hormone. Parathyroid glands are the small glands that are inside our thyroid gland. Most of us have 4, like 2 on the top of the thyroid, 1 on each side, and 2 on the bottom of the thyroid, 1 on each side. They regulate the calcium. They don't produce calcium, but they regulate the balance between calcium, phosphorus, and magnesium. So by injecting the synthetic parathyroid hormone, we can push the calcium into the bone and it helps to rebuild the bone. And other less commonly prescribed treatment options are the selective estrogen receptor modulator. These are like the estrogen agonists. There is one drug called Evista or Raloxifene in the market. They are not very potent in terms of osteoporosis treatment, but when people couldn't tolerate the most commonly prescribed options, we prescribe these drugs. And the 5th one is a calcitonin. Calcitonin is a hormone produced by the thyroid gland, and it is available in a nasal spray as well as the pill option. It also helps to rebuild the bones. So if you are diagnosed with osteoporosis, the intervention or the treatment besides the drugs are like, improving your dietary calcium and vitamin D, increase the level of exercise, especially strength training and slow repetitive movements. Like, if you are standing while cooking, if you put on 1 pound weight at your ankles and try to lift your hips or lift the legs up, that also helps the hips bone density. So repetitive slow movements with weights really shown to improve the bone density. And classical dance also has shown to improve the bone density because of the posture and the slow movements. And any form of exercise definitely helps the bone density, but there are studies done like Pilates, slow fit tend to improve the bone density more. And there was one study done looking at Bharatanatyam versus doing Zumba. People who did the Bharatanatyam for 2 years had a better bone density than it got discontinued. Hello?
We can still hear you now. You're back. You can share your screen again, please.
Oh, can you guys see the screen?
Yes.
Oh, okay. So that also helps. And healthy lifestyle choices like avoiding smoking, alcohol, and carbonated beverages like, sodas, especially the darker colored sodas because they have phenyl ketone in it, which can affect the bone density and prevent the absorption of calcium. Like, Pepsi, Coca-Cola kind of stuff. And in general, carbonated beverages are not good. And maintaining the ideal body weight, not too thin, not too fat, and also drastic, following fat diets, losing weight drastically. Some people, they are on different diets at different seasons of the year, and they lose 10 pounds, gain 20 pounds back, and they go on a fat diet, lose another 10 pounds. Those kind of dietary weight fluctuations will definitely affect the bone density. So trying to maintain a proper weight, stable weight will really help the bone density. And also like preventing falls, like, making sure your home environment is safe, especially if you are at high risk for fractures, and taking the prescription medications as needed, like as advised. Okay, I think that concludes my presentation. If you guys have any questions, I will take those questions now.
Thank you, Dr. Gangi, for an excellent presentation. We will now dive into Q&A.
Okay.
So you talked about calcium and vitamin D supplements.
Mm-hmm.
How important are they? What dose would you suggest? And what is a good age to start taking them?
As I said, it's a calcium is up to 1500 milligrams a day, and vitamin D at least 1000 units every day. I tell all my patients who are older than 30 that they need the calcium and vitamin D. And also if they have any acid reflux and taking acid reflux medicines or any other medications that I mentioned, like steroids or like seizure medications, they should be taking the calcium with vitamin D to protect the bones. Definitely, people older than 40 should be on calcium with vitamin D supplementation, because we start the perimenopause. Depending on the genetics, it can be as early as 40. We start losing the bone in the perimenopausal state.
Okay, the next question is also related to the previous one. Which calcium supplement would you recommend?
It could be calcium citrate or calcium carbonate. Calcium should be taken with food, and it is better if we can divide into multiple doses and take it. I also like the elemental calcium. It is called Esorb. You guys can Google it or find it on Amazon. This is a little bit of, it's a calcium elixir, which has a better absorption than the calcium carbonate or calcium citrate.
Okay, still staying on vitamin D, is sun exposure of 30 minutes enough for vitamin D, or is the supplement required?
No, 30 minutes in a direct sunlight is not enough, especially for people with a brown skin that has melatonin in it. And also, people who are fair skinned, if they go into sun for 30 minutes during the bright day, they are prone for skin cancer too. So we don't want people to go out in the sun without the sunscreen on. And when you apply the sunscreen, the absorption of UV light goes down. So you have to balance multiple things here. So it's in my practice, I check vitamin D on pretty much everybody at least once a year. it's a very rare that I see a normal vitamin D if the person is not on supplements. And I trained in Buffalo, New York. So it was a practice to check the vitamin D over there because it's a cold place and not much sunlight. So when I moved to Dallas, I thought I shouldn't be checking vitamin D in Dallas. But out of habit, I checked it. And surprisingly, many people in Dallas has a low vitamin D. It's no different than people that are in Buffalo, New York. So I think the sunlight is a myth unless it is a consistent, a daily activity. And at the same time, direct sun exposure can make you at a higher risk for skin cancer. So you need to keep that in mind.
Okay, great point there. Our next viewer says that he hasn't had much luck getting the vitamin D test even in the annual physical. So he wants to know if it is possible to get a vitamin test D done and if it is covered under insurance.
Generally, it is covered. We check it once a year at least on majority of my patients. And I'm surprised that I'm surprised to hear that it is not covered. I haven't encountered that problem.
Okay.
And it's a good thing, test to get it checked. If you are tired, if you are having body aches and pains, that could be from vitamin D deficiency. And it's one of the most common vitamin deficiencies.
Is it beneficial to drink milk in the 40s and 50s, or is it only important before the bone reaches peak density?
Milk is considered as a complete nutrition as per the Indian standards, right? Milk has its benefits. It has not just the calcium, it provides some carbohydrates and good amount of protein. There is no recommendation when to drink milk and what age, but it has to be, it's a good idea to have it as part of your nutrition. There is no age limit for it. If you like drinking milk at any age, you can drink milk. But at the same time, we don't want to overdo it thinking that drinking milk helps the calcium. As I said, you have to drink half a gallon to get the required amount of calcium, which is not really a healthy option.
Okay, that's good news for the milk lovers, I guess. Okay, so next question. How long can one take medications for the treatment of osteoporosis? And what are the long-term effects of the medications?
So it depends on when we start the treatment. So most of the data on the medication safety and efficacy is for up to 10 years. So when we see a person with in their 50s with osteoporosis, we choose a different class of drugs like that human parathyroid hormone, which is a different medicine which helps to rebuild the bone. And then we use that for 2 years maximum life time treatment and follow up with the other medications to maintain the bone density. So, but if somebody is diagnosed with osteoporosis in their late 60s or 70s, we may start them on bisphosphonates because we have data for more than 10 years in with that class of drugs. So it depends on when the patient is getting diagnosed, at what age, and how severe the bone loss is, and what are their risk for fracture. We decide on the duration of the treatment and the type of treatment. So as I said, for people who are younger age group, we tend to start with PTH therapy. And if they are older, we may start with bisphosphonates or RANKL inhibitors. And also, if the bones get better and if the bone density improves, we give the drug holiday. We stop the treatment for an year or two, but continue to monitor them with the bone densities and see if they can maintain their bone density without the treatment, just with the calcium, strength training, and vitamin D. So in a conservative way. So it varies from person to person. There is no one answer to this question. It depends on the patient, their risk factors, at what age they are getting diagnosed, and then decide on the treatment.
Okay. Is it common to have a cracking noise from the knee while bending? And is it a sign of early osteoporosis if we are having it often?
No, it's actually, if you are hearing some sounds, it's mostly the inflammation in the joints. It's more or less like the osteoarthritis than the osteoporosis. Osteoporosis doesn't give you any pain or some additional sounds. If you hear those crepitus, it's called the crepitus, where when you move the joint, you hear those sounds. It's mostly the inflammation from osteoarthritis.
Okay, staying on that topic, doctor, what is the difference between osteoporosis and osteoarthritis? I think it's often confused.
Yes, osteoarthritis is inflammation of the joints. It's basically a wear and tear, where the joints lose their lubrication, or they may be having more inflammation markers where you see the pain with the joint movements. Osteoarthritis is very common as we get older, and it can start in the knees, and also you can see it on their hands. People can have the bones get a little bit bigger, or they may have extra growth. They are called Heberden nodes. That is from osteoarthritis. Osteoarthritis is like a wear and tear with inflammation of the joints. It's it's painful to begin with, and sometimes people may start with stiffness and then develop the pain. And the treatment for that is again the therapy, physical therapy, and taking anti-inflammatory. And osteoporosis is a loss of bone density. Generally, it is a painless thing unless you fracture a bone.
Okay, staying on the topic of bone density, how frequently should a person suffering from osteoporosis get a bone density test done?
Currently it is covered by the Medicare every 2 years. But if they are an aggressive treatment, like human parathyroid hormone, then I generally try to get it done at least once a year. But the current standard is to get it done every 2 years.
Okay, our next question is coming from a viewer who's saying that when she takes vitamin D, after a few days, she starts getting pimples on her face, and she wants to know if this is a normal reaction.
Vitamin D is a fat-soluble vitamin, maybe because of that, and it's in, the concentration is basically a fat-based. Probably that's why maybe she's getting the pimples. I don't see a direct correlation with it.
Okay, so the next question is from a viewer who's saying that he's surprised to hear that standing in the sunlight can cause skin cancer. So he wants to know if this is limited to the US, because in India, sunlight up to 10 a.m. they say, is considered good for vitamin D.
No, not really. Anytime you stand in the sun, you are increasing the risk for the skin cancers. It's more common in Caucasians or the people that have fair skin, because they don't have much melanocytes. Melanocytes do protect the skin from skin cancer from sunlight exposure. So people say that, but UV light is there. It reaches the peak from in US, they say it's avoid the hot sun from 3 p.m. to 6 p.m. or 2 p.m. to 6 p.m. It maybe varies from country to country. In the mornings, you may not see as much sunlight, but as much UV as the sun reaches the full, what is that thing, midday, then the UV exposure goes up. But anytime you are exposed to sunlight, you are increasing the risk for skin cancer. It doesn't matter the time of the day.
Okay, and doctor, I know you mentioned this, but can you recap what is the recommended vitamin D supplement intake for an adult?
It's about 1,000 units per day, 1,000 international units per day. And it is a long-acting vitamin. So if somebody is not good with taking meds like white supplements regularly, they can take 5,000 once a week or a couple of times a week.
Okay. So the next question is says that his daughter doesn't like to drink milk, and if yogurt is a good option for vitamin D.
Yes, it is. It is a dairy product, and here most of the milk and dairy products are fortified with the calcium and vitamin D, and it's a good supplement, a good substitution.
Okay, for a 78-year-old, should they get bone density tests done routinely?
Yes, that is the age group where we see more fractures, and once they have a fracture, it increases their mortality and also, like, limits their ability to move around. So that age group, generally we tend to check the bone density. Again, the recommendation is to check it every 2 years, but if they are at high risk and if they haven't had one previously, we can start screening even at that age group.
What are some lifestyle changes that we can make to keep our bones strong?
I think we discussed that. It's like, minimizing the caffeine, avoiding sodas, and quitting smoking, making sure you have enough calcium and vitamin D in your diet and a regular physical activity, and maintaining a stable weight, like, no drastic changes in the weight.
Okay, and is hormone replacement therapy safe for preventing osteoporosis?
Hormone replacement therapy is good for managing the postmenopausal symptoms. Given the risks associated with the hormone replacement therapy, we do not recommend that for osteoporosis or preventing osteoporosis. But if somebody has postmenopausal symptoms where they have hot flashes, inability to sleep, irritability, vaginal dryness, then we treat it, not for preventing the bone loss.
Okay, and moving on to our last question for today. How can weight-bearing exercises help improve bone density?
Then we need to look at the calisthenics, because the weight bearing exercises, the slow repetitive movements helps the surrounding structures around the bone, which in turn stimulate the osteoblastic activity and the bone ligand, which helps to strengthen the bone. And it is proven in multiple studies. It is a evidence-based medicine where it is scientifically proven to that a strength training, slow repetitive movement will help to improve the bone density.
Okay, thank you, Dr. Gangi. That brings us to the end of today's Q&A session. Now over to Pooja for announcements.
Sure. Thank you, guys.
Thank you so much, Ragini ji and Dr. Gangi. It was such a informative, beautiful session today. We had so many nice questions, and what I liked most was it was so apt in terms of practical tips and very easy to understand. Thank you so much for taking your time, Dr. Gangi. Really nice session today. We have various activities. I just want to bring attention to all our viewers who have been following JKYog CICE and all the various programs JKYog has been offering. So I'd like to bring up a flyer. Okay, so starting February 1st, we're going to have a morning session at 7:30 morning. It is going to be a beautiful packed morning session. Definitely register for it. It's going to start on February 1st. Nice meditation, beautiful tips from Swamiji's various teachings that he has provided us. That's going to be nice. Please do join that program. And now the Darshan is going to start very soon. The date will be announced. Look out for that. And we're going to have a new Sanskrit class that is going to start February 17th on every Monday at 8 p.m. It has been a very popular class among various people, so please join our Sanskrit class when you can. All CIC offerings are there on the JKYog website. I'd like to take this opportunity to go through like the various programs we currently are offering. while you see CSE Center for Indian Culture and Education, we have a bunch of them. If I could only scroll out here. So our whole week is almost getting full packed. Sessions that have been started by the Prem Yoga community. So do look out for that information. And we're going to have a Bhagavad Gita study circle that is going to start on Thursdays. Then we have a book club for awakening your best self. I'm going to start a book club on Saturday at 8 o'clock. So do participate. I am so excited about that myself. And then of course learning sutras, various Bhagavad Gita classes, various times, some of our recitation, most of them are study circles. So you find something that is convenient for you. At 9 o'clock every day, from Monday to Friday, we have daily wisdom from Bhagavad Gita. Classes and it's very interactive to participate in that. So we do have our WhatsApp. The QR code is right there. So if you'd like to get reminders for the program, scan that QR code and be part of the WhatsApp group. Various alerts and reminders. With that, and thank you to Ragini ji and Dr. Gangi for this beautiful session this evening, and wish you all a very good night and have a nice weekend. Thank you, Ragini.
Have a great day.